Hello, and thank you for tuning in to McDougall's Medicine with Dr. John and Mary McDougall. I'm your host and their daughter, Heather McDougall. And tonight, just like every night, I will try to get to as many questions as we possibly can. But first, I would like to say hi to you, Mom and Dad, Dr. McDougall and Mary. How are you?
Oh, we're doing pretty good.
Good.
This has not been an exciting week for news, though, Heather. You know, they're still trying to figure out how Ozempic works. You know, they have a New York Times article that nobody knows how it works. I know how it works. You make people so sick they can't eat. I know how it works. But no new information on our failures to detect various kinds of cancers or shortcomings of treatments that you've been over.
There's something
Something
in one of your journals that you can talk about.
You know, I read about 13 journals every month. Isn't that crazy? Yeah. So, you know, usually I pick up some news that I can share with you in the beginning, but maybe it was because I was so focused, Heather, on this series we've been doing. You know, I have to tell you, I'm really pleased with the way this came out. And it's called McDougall's Medicine, a challenging second opinion. That's what I'm going to call it, regardless of what anybody else thinks about it. It's called McDougall's Medicine, a challenging second opinion. It turned out to be 10 hours. I think we're going to have to divide it in half, each of the lectures, to make it more palatable for people. But, well, I tell you, our audience really paid close attention for the whole 2 hours during every lecture. So, I don't know, maybe, you know, usually people can't tolerate any more than 45 minutes or an hour of lecture time. And they're very attentive people. So I have to assume they like the subject. Anyway, I gave this 5-hour series we just finished yesterday. It was about the deadly dietary deceptions and how these lies sell product, including product in the medical business. I mean, when you believe that plants are deficient in protein, then you're not going to eat plant foods, which were the secret to your good health. If you believe that you have to eat fish to get essential fats. And by the way, these things are totally untrue. It'd be one thing if there was just a hint of honesty to it, but it's just a plain simple, big fat lie. You don't need to eat fish to get fat. You know, there's plenty, it's all made by plants. You know, if you believe that sunshine is no longer any good, you know, that you can't trust it, what you need to do is take supplements of vitamin D. I mean, that sells a lot of product. You know, and that's what we went over yesterday. It was the deadly dietary deceptions that sell a lot of product. And that's what they do. I mean, you can't get all the essential amino acids and plant proteins. It's nonsense. I showed you all the literature. There's nobody who's going to argue any of these. Not a single person will argue on a scientific basis any of the points that I've made. And again, if it was, you know, just a tiny bit of truth they had to hang on to, that'd be one thing. You know, but like for the protein myth, you know, you'd be shocked to know that our protein requirements today are based on bigotry of 150 years ago. 150 years ago, Carl Voigt, who was a famous nutritionist at that time, he made an observation. And that was that people who were wealthy, there were soldiers and workers, he called them. And it wasn't just him, it was other people, other scientists at that time, that they would choose richer foods. They would choose meats and desserts and dairies and so on. And so what he did is he took these people, these wealthier people, which were primarily white people, by the way, not people of color. And he looked at their diets and made the assumption that people would instinctively choose the right amount of protein. It would be an innate ability we had to determine by our food choices at the table how much protein we need. So they made 100.
Why would you choose the right amount of fat we ate then?
Well, I see people choosing at the tables the right amount of pepperoni pizza. That's their innate ability.
I have to admit, I couldn't believe it when you told me that is actually the way.
That's all. No scientific studies, no urines, no bloods, no histories, no nothing. Carl Voigt and about 6 other researchers in the 1800s looked at people and said, well, the wealthier people, the whites, the wealthier people, the people who can afford to choose the more expensive foods, the higher protein foods, would innately choose the right amount of protein. So that became the standard, 135 grams of protein a day. That was the Carl Voigt principle. Okay, that's what he was known for, Carl Voigt. And then what happened is a couple of important researchers after him contested him, like Mikhail Hinhidi, he was one of them, and there are a few others that contested. Look, they said things like, hey, how can it be that there are people working in the fields, and they had to be people of color, yeah, people working in the fields, toiling, picking the crops, building the pyramids, building the roads. How can it be that these people are able to function in their heavy labor jobs on half the amount of protein as these richer white people? Bigotry, believe me, that's what your protein requirements are based on today, was bigotry of the 1800s. I wish I could point out some science for you, but it's not there. I didn't start doing some science until later on, about the 1920s,
They never
1930s.
changed their mind, though.
No, in fact, they came to the conclusion, Mary, that you needed so little protein that it was impossible to design a diet too low in protein. You couldn't do it.
But did they put out an announcement that we changed our minds, or?
No, they haven't changed their minds. That's the thing. Yale and Harvard and the medical schools around the country and the nutrition departments, they still recommend protein intakes more in the direction of Carl Voigt than what is correct. Let's just put it that way. And they still say you can't get all the essential amino acids from plant foods. Yes, they do. Even though the American Heart Association came out and told the truth, I kind of forced them to do it, told the truth and published in their journal Circulation. They published my comments on the nonsense about plants don't have all the essential amino acids. And they admitted they were wrong. The American Heart Association did.
But they did it in kind of this roundabout way. I wasn't pleased with how they did it.
Well, what they did is if you look under the American Heart Association website, you look under vegetarian diets and you look up protein, what you'll find is they say all plant foods contain all the essential amino acids. You don't have to combine. It says it right there in black and white, so to speak. Anyway, I had a lot of fun putting together these myths, like I did the one on fat on Saturday, which is basically fatty acid deficiencies unknown, except for people who have severe injury, such as you have all your intestinal tract removed, or you do some experiment where you feed little babies a synthetic mixture that has no fat in it. They develop fatty acid deficiency. And you can correct it just by putting a little safflower oil on the forearm. That's how little our fat requirements are. Anyway, I had a lot of fun presenting this yesterday. There were probably 10 dietary myths. If any one of them was accepted as common knowledge, because it's the truth, if they just look at the data, if they just argue with me, if they just put up some type of defense as to why these are medical schools and health departments that are saying this nonsense, then it would be okay, except that what would happen is everything would change. Now, what would happen if people started believing that plants were ideal food? What would happen to the pharmaceutical business, your hospitals, your doctors? They'd be driving taxi cabs. It would be a tremendous revolution in terms of economics in this country if the truth be known, but it's so simple, it's so obvious, it's so clear, it's so uncontroversial. Anyway, let's get away from that. What I was going to say is I did this with the other 4 lectures too. The lecture on weight loss, which is the first lecture, I just explained to you, you can't beat the hunger drive. You've got to either make it sick with Ozempic or low carb diets, or you got to answer it and eat. That's what the first lecture is about. It's about hunger. Second lecture is about diabetes, and you learn about insulin. Once you got the insulin you understood, then it becomes easy to understand why you get diabetes and why being too fat causes diabetes and what to do about it. And the third lecture was about heart disease. And once you understand that the reason all studies on angioplasty show that it does not save lives. Did I say, no, did I move correctly? Did I say it? I can show you, I can show you 8 review papers, which reflects all the research done, which shows not once did they ever show that Angioplasty saves lives. And the reason is because they operate on hard fibrous scars, on plaques. And what kills are pimples that rupture. So once you learn about the hard fibrous plaques, then you got the whole thing about heart disease down. And then the fourth lecture was about cancer. And I explained to you, as I have on this show, the natural history of cancer. It takes about 10 years of growth before a cancer raises its ugly head. You don't have any idea you have cancer until, on average, 10 years after it started. And once you understand that, then you understand why early detection fails. It's really late detection. You understand why local treatments fail, like radiation to the organ, whatever it is, breast, prostate, colon, or surgery to any of these organs, why it fails. It's a 10-year-old disease. Anyway, there's the 5 lectures for you. I guess I'll tell you, I'm just really glad they're in the can and done. And I can relax for a whole couple of days until we end up in Palm Desert, where I'm going to get the Luminary Award. Did you ever figure out what luminary means? It's like it's illumination, or
Yeah, I guess.
I don't even know what a Luminary Award is, but I better figure it out before I show
You
up.
better, yeah.
Anyways, on the 11th, there's an organization called Nutrition, and it's a group of physicians primarily, over 500, maybe 1,000, maybe there's more. I think there's more, but there are about 500 that'll be at this meeting, and they're going to give me an honor. So I'm honored. I'm proud. I haven't gotten that many recognitions, folks. It's not like I got this whole string of awards or ribbons behind me. I don't, but I have a few, and I'm glad that. Anyway, that'll be in Palm Springs on September 11th, 2023. Where's the 10th? The 10th, Sunday night, whatever it is. I forget. Heather, you got questions?
I have so many. I did share a link in the chat about the course. If you're interested in purchasing that, you can do that. There's a link to buy it. And let's see, lots of questions coming in. The first question, we get it a lot. What are your thoughts on coffee?
Well,
You want it personal or you want it professional?
Well, I think, yeah, I mean, one question came in, does Dr. McDougall and Mary, do they drink coffee?
Yeah.
And then the second question was, what are your thoughts on coffee?
Oh, well,
Good or
I'll tell you.
bad?
You know, I've had mixed feelings about coffee for a long time, my whole career, my whole life, my whole adult life. Yeah, I've been a user. Yeah, I'll admit it. And it's not that I'm not perfect. It's just that I don't have the same appreciation for coffee that maybe many of you do. You know, I started out with the understanding that coffee increased your risk of heart disease and it raised blood pressure. You know, made you terribly nervous. You couldn't sleep at night. And, you know, part of that's true. You know, coffee's a stimulant. It makes you excited, keener, alert, stay awake, wake up from your afternoon nap. It's a very powerful stimulant, and it does do that. It relieves fatigue. So I started out with somewhat of a negative attitude about coffee. I understood that coffee causes terrible indigestion, and decaf coffee is actually as bad, if not worse. And coffee causes you to urinate a lot. Mm-hmm. Yeah, it does. You're always looking for a bathroom, and defecate more than usual too. So that's a problem. And coffee does raise blood pressure, and so does tea, at least for a short period of time, tea does. And coffee raises cholesterol unless you filter it. Okay. Big tip worth listening to us tonight is this. Scientists were kind of confused in the 80s because some studies done on coffee showed that the coffee raised cholesterol about 10% in coffee drinkers, but other really good studies showed didn't. And so they started looking at the methods as to why good studies, good researchers came up with different results. Well, those that raised cholesterol were brewed through a percolator. Okay. You know, those little wire baskets. The ones that didn't raise cholesterol were the coffee was put through a paper filter. And the paper filter took out the fatty acids that raised cholesterol. And so, you know, anyway, let's get down to the positive part, okay? The positive part is there's a lot of research that's coming out these days that show actually coffee reduces the risk of heart disease and cancer and prolongs your life. I'd rather listen to that research. What do you think, Heather? Anyway, it's a plant. It comes from the seed of a tree.
Yeah.
And, we're into plants, folks. Of course, there are other plants that have negative effects too. Like fermented plants called alcohol and heroin and cocaine. And, so I'm not trying to say all plants are all good, but, they do have a positive side to them. And you just have to be careful. So that's how I feel about it. I don't think I'm going to tell you one more thing. And that is, I wouldn't put your coffee habit ahead of you getting well. Too often people say to themselves, well, if I don't fix everything, I'm not going to fix anything. I don't exercise, I smoke cigarettes, I drink coffee, I drink wine every day. I can't deal with all that. That's just too much. So I'm not going to do anything. Now, why don't you just deal with one thing? And pat yourself on the back when you accomplish that. And of course, we would encourage you to deal with the food, because that's going to make the biggest difference for most of you. Some of you, like you severe alcoholics, you got a lot to deal with there, I'll tell you. Anyway, that's don't do that. But, take your priorities and work on one of them and give yourself credit.
One hurdle at a time.
Yeah, give yourself a little credit.
Yeah.
This is not easy. It took Mary and I 2 years to change our diet. Took me 10 years to quit smoking. Yeah, 10 years.
That's because you stopped and started so many times.
It's because you smoked cigarettes. When I met you,
That's
you
true.
made me start smoking again. Anyway, I'll go on. I think I answered that one enough.
Thank you. That was great. Okay, next question. This is from Ray. She had a GI map stool test done recently and found a high level of H. pylori.
Oh,
She doesn't want to
interesting.
take antibiotics. What are your suggestions for treating this infection?
Well, I wouldn't. H. pylori, Helicobacteria pylorium. H. pylori is a ubiquitous infection. About 40% of people in developed countries have it. Nearly 100% in rural countries have H. pylori infection. H. pylori was tied to some serious stomach problems in people who eat the American diet. Yeah, what's found is that infection with H. pylori causes ulcers and maybe some stomach cancers, but not indigestion. When they try and treat just burning sensation and digestion with the triple therapy that I'm going to talk to you about, that doesn't work out. But ulcer healing does work out with triple therapy. So what they find is that when you eat the Western diet, you set up an environment where H. pylori becomes toxic, and it will cause all kinds of stomach problems, like ulcers, for example. But if you eat a healthy diet, then the H. pylori are just innocent bystanders. So why would you want to treat it? Anyway, say you do have an ulcer, which is why you treat it, not because you have an H. pylori infection. And you can look this up, by the way. I would. If I was going to explore this whole thing and give you a better answer, I would look it up. I would look up for studies that show whatever you have, which I assume nothing. Just check your stool for some reason, which don't have any symptoms related to it. I would look for a study that said, well, say you had symptoms like growling stomach or lots of gas or whatever. I look for studies that said, well, treating with triple therapy, which we're going to talk about, treating with triple therapy will relieve my particular problem. There aren't any such studies, and probably because it doesn't even work. But if there are such studies, I'd like to find them and see them and tell you about them. Maybe I'll look tonight. I don't know. Anyway, I wouldn't treat it unless you have symptoms. Then if you have symptoms, say you have an ulcer, that's a sign. You have ulcers. The triple therapy is an antacid. It's a proton pump inhibitor like Prilosec, Nexium, and 2 antibiotics. And as a result, what happens is you cure ulcers. But the problem is H. pylori is ubiquitous. It's like every place. So what happens when you're done with the antibiotic therapy? You're going to get reinfected.
Okay, get it back in.
Yeah.
How can you tell, like you said, if someone has an ulcer, that would be one reason to treat it. Well, how can you tell if you have an ulcer?
Gastroscope.
Oh,
We used to
okay,
do an
so-
upper GI.
Okay, so
Yeah. So you scope them, find out if they have an ulcer.
You don't just guess, you actually.
No, you
look
probably
for it.
you don't want to take a look.
Okay.
Yeah. And we used to do upper GIs before. I tell you, in my lifetime, almost everything has happened in medicine. Really. It is just amazing what I've seen develop. And we went from where we give x-rays, barium x-rays, and show a crater in the stomach, which was kind of an indent due to the barium casting a shadow. And that's how we diagnose ulcers. Did the same thing with colon cancers. We give barium enemas, where you'd lay somebody down, give them an actual enema with a opaque material called barium. That's how we diagnose colon cancers. This was like 30 years ago, or 40, 50 years ago. Now they've embedded these scopes. The problem is to be able to see something that bent. That was the problem. So, we could see things if we looked down a straight line, because light travels in a straight line. But we couldn't see things that had to bend around different curves. And so science developed this technology where they have optic fibers carrying the light, and the optic fibers can be bent. And so now you have flexible tubes, and that's how you get the colonoscopes and the sigmoidoscopes and the gastrointestinal scopes. Because of this technology. That's an amazing technology, but the downside is more diseases diagnosed. And I don't know, it depends on where that leads to, whether it's good or bad. It'd be better if we just went right straight to a diagnosis and treatment, or at least a treatment. I know what the treatment is. You put good things in the stomach. That's what you do. So you put good food in, and you shouldn't have any problem with reoccurrence of H. pylori.
Great, thank you. Okay, next question. This is from John. He's writing in. He says his wife is on the McDougall diet. She fainted on her way back from the washroom. She's compliant, but still has high blood pressure, even with chlorothalidone. What would you recommend?
Well, I'd worry about the chlorothalidone, Heather. I'd worry she's having episodes of too low a blood pressure, particularly when she stands up. So she may think she has high blood pressure because she's not taking her readings in a comfortable, quiet setting that gives you an accurate reading. And my guess is if she did that or wore a 24-hour monitor that checks the blood pressure over a 24-hour period of time, she'd be found to have a normal blood pressure.
Or maybe she's assuming that her blood pressure while she's taking medication should be just as low as it would be.
That can be if she's overtreating it.
Yeah,
She's trying to be normal.
yeah.
That's another way of looking at the problem. So anyway, I'd suspect the chlorothalidone. First of all, a young, healthy woman like this, how often do we not get them off pills, blood pressure pills, and get them to have a normal blood pressure? Fewer than 10% of the time. 90% of the time, we reduce or stop the blood pressure medication and the diabetic medications. That's what our research shows.
Well, don't you think? I mean, my theory is that people have been told for years. We talk about it all the time in the evenings when we're discussing how many things have changed over the years.
Mm-hmm.
But I mean, people have been told for so long that they need medicine to keep their blood pressure under control that they're almost afraid not to take it because what if something happens?
Right. At least I was doing the right thing.
Yeah.
I don't have to feel guilty. At least I got my mammogram done. At least I had my colonoscopy. At least I was taking my blood pressure pills. But you had a stroke. You died. I know, but I was doing everything everybody told me to do, so I don't have to feel guilty. There's something called the poly pill. This was really, really popular in the early 90s. It was a pill that actually was sold in Europe. The drug companies in the United States stopped it from being sold because it would take away from much higher profitable brand name drugs. They couldn't risk losing the business for, whatever the brand name at that particular moment was for blood pressure, diabetes, or whatever. But they had a poly pill. And the poly pill, I'm trying to get the things right. It had a blood pressure pill. It had a diabetic pill. I think it had a couple of blood pressure pills. It had a statin in it. It had, I think, some omega-3 fats. And aspirin. It had a little aspirin in it. And it all came in this one pill. called a poly pill. You can look it up. All right.
I remember.
Yeah.
that you talked about it. Yes.
Yeah, I'll tell you what a real poly pill is. It's called a potato. That's the poly pill I want you to take. Anyway, they tried to sell this across the United States. It never hit the marketplace. Again, I have to believe it was economic motives. It was sold in Europe, the poly pill. Yeah, the more the better. Give me the pills. Give me more pills. You know, there's got to be at least one pill that helps me. I used to play this game when I was a sugar plantation doctor. I took care of 5,000 people on sugar plantations on the Big Island of Hawaii for 3 years. That's my job. I caught their babies. I pronounced them dead. I refilled their pills. I used to play a game with my patients. I knew it was a game back then, by the way. Even though I didn't understand the no things, I knew I was playing a game with them. They come in and see me with a complaint, say an ache here or pain there or something. I say, try this pill. Come on back. You know, they had free care and they had a free bus ride up to the clinic. It was that kind of a practice. Come on back if it doesn't work. I come back the next week. They said, Doc, this pill didn't work. Well, here, try this one. Come back next week if it doesn't work. I never ran out of pills.
And they never got better.
They never got better. That's why they're called patients, because they ran out of patience. But, you know, it's just a silly game. And it's called managed care. And it's what your doctor practices. I assure you, 99% of you out there are being cared for by doctors who are being taught to manage their patients. Managed care means we switch you from one brand of drug to another, from one kind of operation to another. You never take people off drugs. Okay, that's against the rules. The drug company set that up for me when I was a young doctor. Don't ever think of stopping these medications. You're on blood pressure pills for life. You're on diabetic pills for life. What are you supposed to think as a patient or a doctor? What chance does a doctor have in helping your patients when this is part of your formal education? Once you're on these pills, don't even think about stopping them. Anyway, let's get back to the low blood pressure reaction. The first thing you need to suspect is chlorothalidone. The other thing I'd ask you to consider is whether your wife does not need the medication. And I would not prescribe chlorothalidone for a patient of mine whose blood pressure was less than 160 over 100. Over 160 over 100, I'd start prescribing it because that's what the science says. But otherwise, I wouldn't. I certainly wouldn't try to mention normal. You know,
Yeah.
make it 110 over 70. Well, I know you're going to be in trouble. You're going to increase your risk of heart disease and strokes. You overtreat your blood pressure, you'll be in big trouble. These pills are dangerous. That's why they sell.
We tell people to always check with their private physician before they start changing their medication on their own, because they could get in trouble if they didn't.
We have this as a formal recommendation, although tens of thousands of people seem to find our work and other folks' work and decide they're going to take control of their own health. And we don't recommend that. We recommend you get advice from an experienced healthcare provider. That's the key word. I mean, how many doctors are used to taking you off drugs or changing your diet or telling you what to eat? The problem is you don't really have access to experienced healthcare providers, but there are a few out there. It's like the plantrician doctors that we're going to see next month. They want to be better doctors. It's not that you can make more money pushing plants, because you can't. You know, they want to help their patients. They became doctors for the same reason most of us did, and that is you wanted to help other people. And so they have these 500, I think there are over 1,000 physicians that belong to this group, but there'll be 500 people there on September 10th. Yeah, 10th. This is the 10th, Sunday night, when I get this award. And I'm going to give a lecture too. I'm going to give a lecture. This is not the purpose of this hour, but I'm going to give a lecture on the past and the current and the future of medicine. I've never given it before. I've got to put it together in the next 2 weeks, but that's what I'm going to be sharing with these people is the past, the present, and the future of medical care. From my point of view, that's the lecture I'm going to give on Sunday night. Anyway, Heather, next question. I know I went way too long on that one.
That's okay. They're always great answers. Thank you. Okay, this is from Liz. She wants to know if reactive arthritis also responds to diet therapy.
I don't know what reactive arthritis is. I would just call it inflammatory arthritis. Reactive would probably mean you're reacting to something. I don't know. You could be reacting to dairy proteins. How about that? Or you could be reacting to a virus. How about that? Or a vaccine. How about that? I don't think there's anything called, there's a reactive arthritis. Oh, an infection, triggered by another infection in the body. Interesting.
Yeah.
Okay, so correct me if you can. You did. Okay, there is something official there.
Even you learn something sometimes.
Oh, really?
Yeah.
Reactive arthritis. So, no,
It's rare.
very rare. Fewer than 20,000 cases per year. I would deal with the infection. If this is due to arthritis due secondary, and didn't I mention infection before we even brought this up? I think I did. If we said this was a reaction to an infection, deal with the infection. Lance the abscess, clean up the wound, give some antibiotics, and then maybe the arthritis will go away if it's truly reactive. So in answer to your question, you must deal with the cause first. And then, because you may have something more than reactive arthritis, maybe you're reacting to your dinner plate, which is what most inflammatory arthritis are. They do to the food. And do we get good results with them? Yeah, we do. We get really good results with people with rheumatoid, lupus, psoriatic arthritis, ankylosing spondylitis, non-specific arthritis, but probably not reactive arthritis. Because you got to take care of the infection. Or it could have been reactive from a vaccine. Then I would tell you, because that's another thing. If you keep looking at, I'd say, well, just don't take any more vaccines. You say, well, doc, I thought you believed in vaccines. I thought you think they were good. Well, I do sort of, yeah. In fact, yeah, I know. Mary and I went and got a couple of vaccines last week.
I
Can
still
we
have
talk
a
about that? Because there's a few questions coming in about what vaccines you recommend. And I know you're like some, but not others.
First of all, I want to qualify by, I'm not that kind of expert that would get up on a stage and argue with somebody else about the value of vaccines. So I'm not that kind of authority. All right. I've had to learn a little bit about them from my own family's needs. And so that's the point of view that I'll tell you about this, not from the point of view of an expert or a doctor or a scientist. I'll just tell you what I've discovered on taking care of my family with vaccinations. Vaccinations are one of the three things that's changed the incidence of disease in all of human history. There are only three things. They're sanitation, better nutrition, and vaccinations. They changed the incidence of disease in the human population. They are a miracle, an absolute miracle. And all of our family is fully vaccinated, the children, the grandchildren, and so on, except for vaccines that don't work. The vaccines that don't work are two that I know of. And I'm pretty sure I can talk to you with some authority on the flu vaccine. Flu vaccine has been a repeated failure for the last 20 years, 30 years, 40 years.
They'll never admit it.
Well, it says so in this research and the science. You go and you look up on our website an article, you just put flu in the question. I read an article I wrote about 10 years ago about the flu vaccines. Still the same today. What happens let me get on to the second class of vaccines. It's the COVID. All right. They got a new one coming out on Monday. And they're talking about it being a variant, a B.2.2, whatever variant. Excuse me, I can't keep up with these variants.
But they admitted it right when they said it. They said it's coming out on Monday and it's based on the variant that was popular last June.
Really?
Yeah.
And that's the problem.
But that's not what's
That's
what's
it.
going on now.
That's why we don't know that. Yeah, we think
Well,
we would like it to be, because that's why we made the vaccine was what the variant was in June, but this is now August or September. And they're worried already. The experts are worried already that the variant has escaped the power of the vaccine. But that's the problem. You see, these vaccines are made against previous viruses, not the current virus, previous viruses. The flu vaccine is made from the virus that swept through the world last year or 5 years ago. Or, the same thing with the COVID viruses now. is there are so many variants. It's so rapid, this virus is changing, that science can't keep up with it. And so the vaccines are virtually useless.
Well, maybe you
I probably shouldn't say that, because some people say, well, they don't prevent you from getting the disease, but they make it less severe.
Yeah.
That you still have to prove to me, but I'll leave it to you. Okay. If that's what you want to argue, it causes it to be less severe, and you think you can still talk people into getting it, the flu and the COVID, so be it. It doesn't prevent the infection because it's the wrong virus.
All right, well, maybe you should explain the difference between something that's caused by a virus and something that's caused by an infection or
Bacteria
or a bacteria.
Well,
like the difference between polio and influenza.
okay, we got pneumonia shots this week. Pneumonia is a bacteria. It's a bacteria which is like, they're big. Okay, you look under a microscope and there they are. Viruses are real little. You can't see them under a regular microscope. So they're a different kind of organism. Viruses are and a bacteria are. But we can make vaccines that attack the coat of a bacteria. Or same thing with vaccines. We can make a vaccine that attacks the virus particles, like their smallpox vaccine, chickenpox vaccine, diphtheria, tetanus. These are all vaccines against viruses. Tetanus. Diphtheria. No, I may have thrown a couple of bacteria in there. Anyway, polio is a virus, I'm sure. And I have to think back about my boss. Chickenpox, yeah, chickenpox is a virus. Measles, there's another one that works. Why they work? Because they all have stable viruses they're dealing with. I mean, it's the same measles that infected me when I was a little kid that's infecting your kids today. There's not a whole bunch of variants. So they've been able to make a vaccine against the measles that had been occurring 50 years ago. Well, it's the same bad guy we have today. But it's not the way with COVID or flu, that we have all these variants that are occurring. So anyway, so the bottom line is our family's fully immunized. Last week, Mary and I got the pneumonia, 20, whatever it's called. I can't keep up with them.
Yeah, we got the 20.
We got the 20.
Yeah.
And we got the shingles vaccine. All right. That's the third time we've gotten the shingles vaccine. I've seen people with shingles. You don't want to get it. Okay. You don't want to get it. It's the same thing with giving healthy young teenagers the HPV vaccine. Prevent papillomavirus infection, which leads to cervical cancer. And it also leads to oral cancer too. People who get cancer of the throat, it's a venereal disease that's passed on by this particular virus. So, I take care of people with these problems. I watch them die. And I mean, it's not like it was a pleasant experience for anybody. I'd hate to have anybody go through this. And so to suggest that you take a vaccine that, when am I going to run against polio? They got rid of all the polio or smallpox. Well, that was, yesterday. You just don't know what's going to happen in your future and what kind of exposure you or your family's going to get. So anyway, I'm a pretty positive guy when it comes to vaccines for my family. Why throw out the baby with the wash water? Come on, guys.
Thank you. Okay, next question. Let's see. Lots of them coming in. This is from Sharon. Is glucosamine chondroitin a safe supplement to take in addition to being plant-based, no oil, and flow?
Yeah, chondroitin is from cow cartilage.
Will they make it from anything else?
Well, I don't know. Maybe they have a vegetarian form. Glucosamine is made from seashells, but I know they have a vegetarian form of that. So you have chondroitin, glucosamine used to be sold as a package. That was figured out that chondroitin really didn't work. So all they sell is the glucosamine now. Then you could buy vegetarian glucosamine. If you look at our website, you'll find an article that I wrote about knee arthritis. And I was very positive about taking glucosamine. Cited a few studies that were present at that time. But if you read an article I wrote a few years later, I wasn't so supportive. it comes back to something I've told you before, and I'm going to tell you again. I reserve the right to change my opinion about treatments, drugs, surgeries. Because the science is incomplete. Because often there are horrible biases in the science. But I've also added as a lasting comment that I hope you all get. I may change my idea about how you should be treated, the drugs and the surgeries and so on, but I will not change my idea about what you're supposed to eat. I spent a lot of time figuring that guy out. So that one is immovable. If I have to change my opinion on what you're supposed to eat, whether it was a starch-based diet with fruits and vegetables, then I'm quitting. I don't deserve to be on stage anymore. But I think you're going to find that I got it right when it comes to the food.
I think so. Okay, next question. Okay, this is from the Experiencer 502. Any recommendations on being on a whole food plant-based diet and having slightly elevated uric acid with some pain in my hands?
Uric acid goes along with gout and also kidney stones that are predominantly uric acid. But you should never treat a high blood uric acid level, hyperuricemia. If it has no symptoms, it should not be treated, period. Where you treat is when you have a definite arthritis, a gouty arthritis, or say you have recurrent uric acid-based kidney stones. Then you would want to treat somebody with a drug. Well, I think they're using something else now, but it was allopurinol. That was the drug used, but it's a very toxic drug. So I always hesitated terribly, the few people I put on it. Usually gout is not in the hands. It's usually in the feet and the big toe. So, I don't know whether the connection is very strong between the slightly elevated uric acid and the hand pain. I would doubt it. I think they're probably totally unrelated, but I understand your concern. But if you definitely decide that your arthritis is due to gout, and the way you would do that is you have your doctor take a needle and stick the needle into the joint and suck out the fluid and look under the microscope and see uric acid crystals. Then you got gout. Anything short of that, you don't got gout. You got to find those crystals. Anyway, that's they probably have some machine that finds them these days too.
Probably.
Well, we used to stick a needle in the joint and suck the fluid out. And you got to have uric acid crystals in the synovial fluid, which is the joint tissue, to have the diagnosis. Otherwise, elevated uric acid in the blood is pretty much irrelevant. Should not be treated. Let's put it that way.
Thank you. Okay, next question. This is from JNO99. She's been McDougalling for 8 months now, down 36 pounds, has 20 more to go. Her menopausal hot flashes have significantly improved, but she still has them and is wondering when they will go away completely.
They usually go away in 2 years, Heather. It takes, for women to go through the change who are in the American diet, it takes them about 2 years from their last period till they're finally pretty comfortable with life. Now, I say women on the American diet because it's only women on the Western diet that get menopausal symptoms. Now, why do I say that? Well, because I learned early in my career that there was no word for hot flash in the Japanese language. Now, that was back in the old days,
There is now. Right?
Probably there is now. Anyway, I got 2 daughter-in-laws that speak fluent Japanese, and their mother, who's 100% Japanese. There ain't no word for hot flash in the Japanese language, or maybe there is today, like you say. But people on a healthy diet just go through the natural change in life. They just stop having eggs. That's it, man. You go on to be grandma and grandpa. So it's not supposed to be a time of sickness. That's the thing. We take natural functions in life, like having menstrual periods, or going through menarche, or going through natural things that occur, that are supposed to occur, that are part of human existence. We turn them into diseases. And the reason they're diseases is because people get so sick from the Western diet, and it gets compounded with these changes. You know, it's anyway. What was the question, Mary?
Hot flashes and when they'll
Hot
go away.
flashes. Okay, there's a whole chapter in the McDougall program for women on it's chapter 13. It's on hormone replacement therapy. It's in the McDougall program for women, and it tells you all about how to take care of hot flashes, including a prescription that I wrote out for you in the book 20 years ago, still valid today. Still can take it to your doctor today. That tells your doctor how to write a prescription to take care of menopausal problems. They're going to give you a pill. You don't want to take a pill. You want to take skin creams. Skin creams are so much safer, so much more effective than taking estrogen or progesterone pills. So that's what I've been using for 30 years with women patients, is I've been using a little skin cream. Works really powerful. It's really good stuff. Anyway, that's in chapter 13 on the hormone replacement therapy in the McDougall program for women.
Thank
I forget
you.
what page it's on.
This is a question for you, Mom. Let's see. Not too long ago, they discontinued the Kirkland's no salt seasoning, right?
Oh,
You have a replacement. What do you use instead now?
Oh, well,
you need to do some research.
no, I mean, I still have a big container.
Doesn't Well Your World make one?
They do. They do. Shoot. Let me go get the little containers I was talking about the other day. I'll be right back.
All right.
All right. Well, while she's getting that, I've got questions for you, Dad. Jim wants to know what you would recommend for AFib. What do you think of ablation?
Yeah, again, well, let me just start out by some qualification. When I'm not knowledgeable about something, I haven't taken the trouble of being an expert, or it's something that's become popular after my time, when I was really active in practice. Ablation is something that's come out during the later part of my practice. And so it's something I haven't got involved too much in, but I do read the science on it. And it's controversial. But of course, those who believe in it, believe strongly in it, and think it's the best thing possible. For one thing, once you have the ablation, which is, let's see if I can describe it at least close enough to being accurate, is they take an instrument, which may be an electrocautery type instrument, and they put it in a certain area of the heart. I think it's in the vein, big vein, and they destroy some nerve cells in that area. And for whatever reason, you go back into normal sinus rhythm. So now you don't have to have the risk of an embolic stroke, or have to take Coumadin or Eliquis or other anticoagulant blood thinning drugs. That's the main advantage. You don't have to be on these drugs. But I think it's something you ought to look into. I certainly would if I had AFib. But then again, you may find out that it's not worth your trouble or the expense or the risks involved. And most people do really well with AFib without any problem at all. What do you got there, Mary?
Well, these are the things that I have found to substitute for that. Unfortunately, they're not salt-free. I haven't found any, but you're right, Heather. I would check Well Your World. They have a lot of combination ones. I'll get one out of the cupboard. I have one of those too. These are made by
Taste of Tuscany?
No, they're made by
Oh, yeah.
Gusta Spata, a Taste of Life. And they're called Taste of Tuscany, Taste of Cajun, Taste of Jamaica's, Taste of Greece. They come in all different kinds, and they're just these containers that have.
But you got to realize we're not totally salt-free either. So
they have seasoning inside.
it's very cute.
Well, they come in the bag, and when you open it, you cut the bag. This one's got all kinds of seasonings in it. It's got, garlic, black pepper, thyme, cumin, cinnamon, allspice, ginger, red pepper, sage, onion, paprika, sugar.
Looks like it's oriented towards like a Hispanic type thing.
Yeah. That's
Jamaica,
what
it
is.
says Jamaica.
Yeah.
There you go.
And here's one for Greece, and that would have different things in it.
Right.
But I'll see. I'll go back and I'll get my Well Your World one. And I'll.
What I was going to add with atrial fib is to slow the heart rate, which doesn't often have to be done. Most people end up with a relatively normal heart rate, say 70, 80 beats per minute. If it's faster than that, say it's faster than 110 beats per minute, you got to slow it down. And you do that with digoxin and or a beta blocker. That's the way I treat it. So, and then you decide whether you need to have an anticoagulant or not. And the way you decide whether you need a blood thinner, like Coumadin or Eliquis, is you go to an algorithm called CHADS, CHADS. They're all in big letters, CHADS, and put in like heart disease or atrial fibrillation. And it'll show up this whole discussion about who should be on blood thinning drugs and who should not. It turns out that healthier people should not be taking the blood thinners, even if they have atrial fib. Whereas, people who have problems, high blood pressure, previous strokes, etc., they need to take the blood thinning drugs. And that's called the CHAD score. So look that up. Yes, ma'am.
Okay. The best one probably is, you're right, Heather, Well Your World.
You got that there.
Yeah. Well Your World. And they make Galaxy Dust Table Blend, no sugar, no salt, no MSG, no nutritional yeast. And they have all kinds of them. Galaxy Dust, they have so many different kinds that that's what I would recommend in place. And so check out Well Your World. It's probably just wellyourworld.com. Let's see.
Thank you.
Right
There's
here.
also Mrs. Dash or Benson's Table Tasty.
Yeah.
I mean, there's
Yeah.
a lot, but like you said, Dad, we're not no salt. So if your spice
Yeah.
blend has a little salt in it, that's okay too.
That's okay. Yeah.
Okay, let's see. Next question. This is from Donna. She's been on your program for 6 years. She's off all her blood pressure medication, but she's a night worker, or maybe she's not now, but she was. And so she suffers from insomnia. What do you
Ooh.
suggest for that?
That's tough, Heather. And I say that not just only from a professional point of view. I talk about it from a personal point of view. It's something I'm pretty much an expert on. It's hard. I think the best way to solve insomnia is to not sleep. And I know that sounds kind of silly, but it's called sleep hygiene. It's been around for 100 years. What you do is you take somebody who says they have insomnia and you ask them, how much time do you spend in bed? They say 8 hours. Well, how much of that time is spent sleeping? Well, only 4. Okay, then tomorrow night, what we're going to do is we're going to only allow you to be in bed for 4 hours. Well, that's just not enough rest, Doc. Okay, but that's it. All you get is 4 hours. Well, you complain, you're too tired, you're fatigued all day long, you need more sleep. All right, okay. Tonight you get to have 4 hours and 15 minutes. And you just kind of work it up so that you get enough sleep to relieve fatigue, but not enough sleep, not so much sleep that you end up having insomnia and or depression. Psychological depression is caused by sleeping too much. And it's a whole lecture that I could give you. So the other things that are offered to you don't really give you more benefit than harm. I mean, taking sleeping pills is really a bad thing. You get into huge trouble. Alcohol. A lot of people take alcohol to sleep. And again, this could be, the beginning of the destruction of your life. So I'd be real careful about looking to drugs to help you sleep. I don't know of anything like valerian or any of these herbal stuffs that I could recommend it and help you sleep better. I don't. No, how about this for an herbal thing?
What?
Well, since I'm in Oregon, it's legal. I could say it.
What? Oh. You mean marijuana?
I wasn't going to say it.
Well, you told me you were
I'm a respectable doctor. I mean, good grief.
in Oregon. You told me it was legal. So what else was that?
I think some people use that to sleep too. Anyway, believe me, it came from her, not me. I mean,
Wasn't your recommendation?
I'm staying away.
You would never.
I come from the 70s. We used to get arrested for things like that.
Yeah, things have really changed.
Yeah.
Okay, let's see. Next question. How to heal and prevent eye branch vein occlusion? I'm sure you know what that is.
Well, I don't exactly. But what I think they're talking about it is maybe
Let's see.
a venous occlusion in the eyeball, occlusion in the retina of a vein. I think I've heard of that. Well, let me just give you the whole food thing. If you eat
There we
animal,
go. Eye branch retinal vein
yeah,
occlusion.
I got that right.
Yeah. Is vision loss or blurry vision in part or all of one
Well,
eye.
that's because a vein gets clogged up
Yeah.
and that little piece of the eye gets in
Can
trouble.
it be cured? It cannot be cured.
Oh, boy. Well, I guess we'll have to prevent it then. What you need to know is that animal fat causes the blood to clot, causes the platelets to stick together, causes the clotting factors to be very active, causes clotting factor 7 to be very, very active, which is the one that leads to heart disease, causes that blood clot in the artery and heart. So if you're going to eat animal fat, you're going to set yourself up for blood clots. Okay. Fish fat does the opposite. It thins the blood and will actually thin the blood to the point of where some people think it's therapeutic. That's why it's recommended for people who want to prevent heart disease. But when I say recommended, I mean it used to be recommended. The whole nother attitude these days when we take the whole picture in mind, and not many people are recommending fish oil anymore. So anyway, it does thin the blood, so that's okay, except when you get in an auto accident, when you start bleeding, and then it's not so good. So the healthiest way to keep the blood at the right coagulation level is to eat a starch-based diet with fruits and vegetables. Don't add any of these powerful oils. And you know, I don't know what they say in there, but they probably recommend you take an aspirin for it because it thins the blood. I wouldn't be surprised. You know,
They use
I put you on a daily aspirin.
ongoing treatment of
Shoot you up with,
intravitreal
what that stuff.
injections. Yeah.
yeah, I know what that stuff is. Yeah.
Doesn't sound good.
Doesn't sound like a good
No.
way to spend an afternoon.
No.
Anyway,
They do say they have laser treatments for it, don't they?
yeah, but my guess is that all they do is they destroy the blood vessel that's already clogged up,
Oh,
and they don't clear it out with the lasers. It's not
okay.
like they return. Look, just don't get sick. Good grief. I mean, you know, 90% of what your problems are, your family's problems, they're due to the food. Fix the food. And then you deal with things you can't control. You know, I'd like to mention some things you can't control. There are things that come to mind, but you know, like you can control whether you wear a safety belt or not, or whether you buy a strong, heavy car or not, or you know, whether you know how to control behaviors that are dangerous, smoking, etc. So anyway, you have control over the food, so fix it. I think what you've heard just from the callers here, which are not staged in any way, I think what you've heard is people who have been very successful in life based on our message. You know, we do not, pay any of these people to call up and tell you this. Is that people get with the program, 6 months, 6 years, etc. Why do they do this? Because
They get better.
they get better. It works. It's the only reason you stick with it is it works. And because it's a little work, not a lot, a little work. Maybe
Yeah,
you don't want to
you're not reading the comments in the chats. I am, and there are dozens of people writing in about how they've lost 50, 90, 100 pounds following this diet. They've been on it for years and giving suggestions to other people that don't really understand the program about what they eat and what they do. So
Oh,
it's
that's
really,
so
Oh, that's
great.
good.
Yeah.
You get a chance to read all those. We never see them. But this also brings up another thing. I know that gets kind of lonely, being out there amongst so many people who eat different than we do. So we try and make as much of a community as we can. And we're able to do that with people who attend the 12-day internet program. We have a lot of personal meetings when during the program people meet amongst themselves without the staff and they get to know each other. And then afterwards, what happens is they form groups where they get together probably once a week and they have an hour or two together and they talk about how they're doing. So they have a whole bunch of people from around the world to voice their complaints and talk about their successes and failures and so on. So we are trying to make some community action. I don't know.
People have found friends in their same town.
Yeah.
And they meet each other and they'll meet up for dinner and even potlucks
Yeah.
together.
Well, maybe we could talk about next time how we can make a community out of this 5 o'clock hour. If any of you can think of a way to do it without it getting terribly out of control, without it requiring a tremendous amount of time, effort, and money on our part, let us know, because we'd like to make a community for you folks too, for the 5 o'clock hour. But I just don't see any practical way of doing it. But a lot of you are very skilled when it comes to the internet and computers and so on. Maybe you'd like to help us do that. We can make a 5 p.m. Sunday night group session. We should do that, Heather.
Yeah.
What's the next program? We're gonna run the next program.
our next course is October 13th.
I imagine this is filling up, so
Filling up
don't
fast.
wait. All right, good. It
All
was
right, we're out
fun.
of time. That was an hour. That was great. Thanks, Mom and Dad, Dr. McDougall and Mary.
Okay, have a good week, you
Okay.
guys. We'll see you next Sunday, 5
No,
o'clock.
it's-
Bring
Okay.
your friends and relatives and show them that John and Mary and Heather are not all that bad. They're okay.